Yes, Oxford. As I wait for Daktari to be joining us anytime, let me first say that last week we had episode 1, whereby we talked in length about reproductive health for both male and female, as they prepare to get a child, that is for conception, and issues of diet, and also what is expected of both genders was discussed. And today we are discussing about the reproductive health from birth and infancy, childhood, teenage, and geriatrics, that is the elderly. So doctor is not used to get to joining us late. I don't know. I'm expecting him that he should be joining us by now, because I have just talked to him a few minutes ago. So maybe we can give him like 2 minutes, because without him we can't proceed. Is it okay?
It's okay.
Thank you,
Okay, Douglas.
Thank you, George. Maybe with your permission, I can check on him. I just come out of the meeting for a few seconds, call him so that I can tell him that he should be joining us, because I don't know what's happening, but I know Ori is where. Maybe he's preparing to join in a moment, but let me have a word with him kindly. Okay. Welcome, Rachel.
Yes. Uko na wote? Nitumie.
Robert,
Ai, ito kioo. Kidogo tu. Yes, yes.
I'm sorry. I think, I'm sorry. I think my mic had not attached it.
Uh-huh.
I was saying that I have talked to Daktari.
Uh-huh.
Unfortunately, he had impromptu visitors, and he has said that you'll be joining the meeting within the next 2 minutes.
Uh-huh.
So I was asking for the members to be a bit patient
Okay.
as he's setting himself to join the meeting.
Okay, no problem.
We apologize for this. We normally start the meeting at 7:30 to 8:30,
Okay.
but it seems we are going to start the meeting immediately. He joins there about by 7:40 or 7:41.
Okay. Thank you.
So I ask for your patience. Tafadhali. Good evening, Daktari.
Good evening.
I can see you've just joined the meeting and you can hear the silence. We are waiting for you.
Sorry about that. I was in a meeting that I could not excuse myself from. So sorry about the delay. But
Welcome.
I think we
So,
can be able to proceed.
yes, we can proceed within the next 1 minute as you settle.
Yes,
Now we are starting. Yeah, we are starting now our meeting officially. We are late by 15 minutes. Let me first start by welcoming all of us in this meeting. This is episode 2, proudly sponsored by Matters Health Association. And we are covering a very wide topic called reproductive health, which is both interesting and also at the same time controversial. Last time we discussed about reproductive health in matters to do with conception. And today, Dr. will take us through reproductive health in birth and infancy, childhood, teenage, and geriatric. Without much ado, I would like to start by maybe giving what is reproductive health in a nutshell. Reproductive health is a state of complete physical, mental, and social well-being, and not merely the absence of disease in all matters relating to the reproductive system and to its functions and processes. My name is Douglas Wamwiri. I'm the founder of Matters Health Association, and the doctor that will be taking us through is called Dr. Nicholas Kariuki. He is a lecturer at Kenya Medical Training College, Department of Medical Education. Daktari, you can take over and take us through. Karibu sana.
Thank you. Good evening, everyone. So as we learned last Thursday, there's so many things that we need to look into and to put into consideration when we talk about matters health, and especially matters reproductive health. And that is why we are learning what you're trying, what we are learning today, so that at least at the end of the day, we can be able to improve on what God has blessed us with, and we stop doing things just for the sake of doing them, but we do it from a perspective of understanding of using the knowledge that God has blessed us with. Now, we mentioned a few things about health, or rather, yes, about reproductive health last Thursday, and especially things to do with preparation for conception and how conception takes place, and the things you're supposed to do, especially things to do with medical or rather checkups and nutritional preparation and mental health and issues related with reproductive health. And today, I want us to talk about, just to mention a few things about things to do with what you need to avoid, or what mothers need to avoid when they are expectant. And that is why we're going to start today. And one of the most important things that we fail to do is to understand that everything we take, especially in terms of medication, and that is why at times you say, when a mother wants, or when a lady wants to become pregnant, they need, first of all, to get a medical checkup, so that anything that they are taking, or any medication they are taking, because most of the medication that people do take, they have their own side effects, and some of them have something we call teratogenic effect. That is to mean they can affect the formation of a child, and at times they can even affect the genes and the chromosomes that make a child, and you can get a child who is deformed. There was a drug that was being used a while ago, but now it's no longer used. That when women used when they were pregnant, children were born with no limbs, nakuta hana mkono, hana miguu, and things like that. And I'm sure even at times you have seen that when you've gone to some of the children homes, you have seen kids who have been born like that. And that is why we say, because now we have the knowledge, because now we have the understanding, it's prudent. It would be prudent for us to know how to handle or how to utilize the information that we have to make sure that the coming generation are better off than us. Do you know that there are some drugs when you take, when a mother takes when they are expectant, can cause their children to have neurological disorders? And what do I mean by neurological disorders? Neurological disorders are disorders that are associated with things to do with how you function. Okay? Your brain, your eyes, your ears, how even matters your lungs, everything. So, like for instance, within the first 3 months of pregnancy, if you take some drugs that are used to treat something like TB, they can affect the formation of your child. Your child can be born with hearing disorders. So, and that is why we say, and at times you find people, because of issues to do with poverty and related stuff, you find people, you get to find that people are not very perceptive of what might be going on within the medical profession because of issues poverty. And it's my prayer that God will give us an understanding that, so that we understand that at times it might be very expensive in the long run. When you think you are saving 200 bob or 1,000 bob for failing to go have a medical checkup, it can cost you a lifetime in hospital. Because, for instance, when things like now you have a child, your child develops something like hearing disorders because of taking a drug that you are not supposed to take in pregnancy. Or even when at times when a lady is vomiting, there are some drugs that they may take that can affect a child to start developing or to develop issues to do with epilepsy in future. Are we together?
Very much.
So it's prudent. I don't know how I need to explain this, especially the first 3 months after conception. It's prudent for us to make sure that within that period, any substance associated with drugs that you take, that you have to consult your doctor. Otherwise, at times I think it's by God's grace that some of these things happen. So, I'm trying to just give us an update of whatever we talked about and trying to see how we can be able to connect and look at the next topic. That's where we're talking about the infancy. Now, there's something else that is very, very important that at times we take for granted. And what is that? This is where we give birth and how long second stage of delivery takes. Now, we need to understand that the second stage of delivery is the most important one. And if a child takes a little bit longer before they are delivered in that second stage, it can cause a lot of issues. Because that is where at times children develop issues to do with neurological disorders, learning disorders. And before I get there, by the way, it's also very prudent for me to mention that most of the issues that our children experience in life, because you see, for a child to be born, we have two things that affect them. One It's the chromosomes or the genetic makeup. And this one comes from both parents. And that is why we said the both parents, if they do not take good care of themselves, and if they're affected by issues to do with malnutrition, or they have any deficiency in their system, when they are transferring the same genes to the coming generations, there is a possibility that you're passing on a deformed or weakened gene. And that is why at times you find that within the first month or 2 weeks of conception, more than 50% of the product of conception usually they are aborted. And at times even the mother does not know that she had conceived. But some of these things happen because of what you're talking about, malformation, or rather defective genes. The body or the body of the woman or the body of the lady has the ability to detect to detect this kind of deformities, and so it rejects the formation of, or rather the growth of that particular thing that is forming, that is deformed. So, by the way, when there is deformity in the system, at times they don't get to see or to mature to birth, because the body has a natural mechanism of rejecting deformed fetuses. Are we together up to there?
Yes.
Now, so the other thing is after the genes. So the other thing is now what we're talking about, the external factors, what the mother takes. Do they take, or rather, the food, the nutritional intake? After the nutritional intake, then you also talk about things to do with the mental or the physical stress that the mother is experiencing at that particular time. And also use of substances, and in fact, even things to do with things like alcohol, tea, or coffee, or things like that. All those things, because they have some neurological effect on the mother and also on the child, they have some effect on the fetus. And that is why they say, for a mother who is expectant, okay, they can take coffee, but not more than 4 cups of regular coffee per day. Because when they exceed that, the caffeine in coffee and also the caffeine in tea can start affecting the child. Are we together?
Yes.
To that particular point. Yes. So, I want to pause there for a few minutes and just ask something from us. Do you have any questions so far, so that I go to the next phase?
Okay, Daktari, that was well articulated. And members, on your phones or laptops, there is a hands icon. I would kindly request that if you want to ask a question, kindly press the hands icon, and I will see it, and I will give you a chance to ask a question. I'm sure by now we have learned a lot, and we must be having some questions at the back of our minds. this is the right time to ask 1, 2, or even at most maybe 3 questions or 4, then the daktari will answer them, all of them. Anyone with a question or an observation? People are very quiet. Is that a sign? Yes. Is that a sign that we have no questions or we are very keen? Okay, let me ask mine as others are planning to ask theirs. Daktari, mine is not more of a question. It's more of something that I've learned today. I didn't know that some conditions like epilepsy can come out as a result of prolonged birth labor pains or at the point of delivery, or maybe by some other external, by other factors. So that's something I've really learned today. And I've also learned about other deformities that come as a result of what we take. So it means that nutrition plays a very major role, according to what I've listened. Anybody else, kindly? Robert, can you see someone raising hands on your end?
On my end, I cannot see any hands.
Okay, maybe George, do you have a question? George, do you have a question? Okay, Daktari, I think silence means that we have all understood or we are digesting what you have articulated so well. So I return back to you. We continue from there, and maybe you can say something.
Thank you. I was trying to connect with my laptop, but it's not connecting. I don't know why, but let me just continue on the phone. Now, I have talked about the importance of labor, or rather, the importance of safe childbirth and what happens during labor. Because you see, mainly labor depends on how the fetus or how a child presents during delivery. If a child presents in a way that that is abnormal. For instance, you can have a child, instead of presenting with the head,
Yes, Doctor.
they present with a leg or a hand, or instead of or even at times they present with a face, which might lead to prolonged labor. And during that prolonged labor, that means the umbilicus there might be some pressure applied on the umbilicus, and that during that particular time, that means the child who is about to be born is not receiving enough oxygen. So we start having a state of lack of oxygen in the brain. So in the long run, you start experiencing, or the child experiences, brain damage. At times, you have excess bulging or swelling of the head, because when the child is passing through the birth canal, the bones of the scalp, because the head is usually the biggest part of the body, kind of collapse. And as they are collapsing, at times, because of excess push during labor, at times you might experience something we call hematoma, or others, blood clots forming on the scalp. That at times can lead to what you're talking about. So when all this is happening, so it can happen through
epilepsy now.
Not necessarily epilepsy, but epilepsy can develop from there, because epilepsy is just a state where the brain neurons, or the transmission of neurons within the brain system, is somehow defective. And depending on how defective they are, that will determine how the epilepsy develops. And not only that, even after birth, when a child gets sick, especially when they are 2 years and below, when they get something like fever, and fever can come because of any kind of disease. It could be bacterial, it could be viral, it could be protozoa, that is things like malaria and things like that. When the child develops fever that goes beyond 39 degrees Celsius, you find that at times children, or rather infants or children, develops what we call febrile convulsions, which now are also related to something we call to the tonic-clonic muscle spasms movement. That is like what we have in epilepsy. And most of the epilepsy at times develop as a result of, we have more epilepsies developing as a result of fever than brain damage. I hope we understand each other there.
Yes, Dr. Well answered.
So,
to my satisfaction.
So when you look at it from that particular perspective, then that is how you need to look at it. So that is one thing we need to put into consideration. Sorry, I don't know.
For that, Dr.
Let me switch off one. I think now I'm on, eh? You can hear me?
Yes. Dr. Is there some echo from your side?
Yes, I've switched off the other one. I think now the feedback is
now, we hear you loudly.
Okay.
Yeah, loud and clear.
Sawa.
Yes.
Good. That is it. So I think we can talk about now childhood or infancy. It's prudent that we make sure that we feed our children or our infants the best way we know how. And at times the best way we know how is just to make sure that they have a balanced diet. And of course, most of us know that we recommend that the first 6 months of life the best meal you can be able to give your child is just the mother's milk. So that's the best recommendation we have for bringing up children. And that means if that child is only depending upon the mother's milk, that means the mother needs to take a very balanced diet so that they can be able to provide for all that child or that infant needs. And the other thing is you need to be very sensitive and make sure that we give children nowadays the necessary vaccines or vaccination that are recommended in the nation. Because, like you remember, I think it's around 2 or 3 weeks ago. Yeah, 2 weeks ago. In Mombasa, we had an outbreak of rotavirus. And I think it killed a few people, I think 2 or 3. And rotavirus mainly affects infants or children under 5. But some of these diseases, we've seen diseases that are developing nowadays that can affect people at whatever age. And at times, for those of us who are there a little bit earlier, we used to have very many deaths as far as contagious diseases are concerned. Things to do with measles, things to do with chicken pox, mumps, and all this, rubella, and all this kind of stuff. But nowadays, because our children are vaccinated against them, even when they get infected, they get just a mild form of infection, mainly because they already have a vaccine that has helped their body to develop some immunity that helps them to fight the disease that they have that has affected them. So it's a good thing. Make sure that your child has an updated vaccine coverage so that whatever age they do what they need to be done. And even for us as adults, we need to make sure that the vaccines that we need to have, we also have them. Especially for our fathers or our parents, because I know some of us have parents who are a little bit elderly. When our parents get to past the age of 60 or at times 70, 75, going those sides, when you was also another to affect you, and things to do with arthritis, things to do with pneumonia and things like that, we need to make sure that they get the pneumococcal vaccines, so the pneumonia vaccines, the viral vaccines, simply because we don't want them to get infected by those viruses that comes in the cold seasons. Like now, we are heading to the month of May, June, July, the cold season. So this would be the best time for us to start looking for those particular vaccines so that our parents who are a little bit elderly can be protected against these diseases. No, now we get back to our reproductive health. So if we don't do that, if we don't cover our children with those vaccines, what happens? Something like a disease like mumps, for the young boys, it affects the testicles, or rather, not only the testicles, it affects the lymph nodes, or wherever they are nodes. So it affects the salivary glands, and then goes down there, the testicles. And When you're not careful, this could be one of the sources of infertility in men. And then you start asking what happened to your children or what happened to your son, but it's just because at times they got such kind of a disease. So it's prudent that you make sure we do what we need to do and at the right time. But not only that, many diseases that are associated with febrile convulsions. And before I get there, let me just revert a little bit. After birth, the mother and the midwife need to make sure that a child who has been born is has been inspected, or I think inspection is the right word, has been inspected well, and they will make sure that they have all the organs where they're supposed to be. Some children are born with something we call imperforate anus, so unakuta hawezi enda choo, pengine njia yake ya choo haijaformiwa vizuri, so and they need to be taken to theater. Others, they are born with undescended testes, so when you touch that pouch where the testes are supposed to be, you find that the testes are not there. So this, when realized early, especially at birth, that means you need to start examining that. You give them like around the first 1 year. If by year 2, the testes have not descended, that means you need to plan for surgery so that an operation can be performed to make sure that that particular individual or that particular child has been sorted out. And now also because of some people in the society are getting married when they are quite old. And that means at times the genes have mutated to some extent. You find people now who are born with what we call undeveloped or poorly developed sexual organs. You all know that now we are living in a society where we have a lot of advocacy when it comes to things to do with LGBT. And at times that is associated with what we're talking about currently. But, and that is why I think even my friend was talking about the controversy that is there when it comes to matters reproductive health, where you hear somebody saying, okay, fine, I might be having an organ of a man, but I'm a woman, or vice versa. I am a woman, but I am a man, and we want to have all this done. But that is a debate for another day. I don't want us to get to that. But it's quite something.
Dr.
Yes.
We are losing you a bit.
You can't hear me?
From that point of whether you're a woman or a man.
Okay. So but I think you can hear me well now.
Yes, I can.
Okay.
Or rather, we can.
Sawa. Yes, that's what I mean. That when it comes to matters LGBT and matters how sexual organs are formed, we need to be very sensitive. Because there are genuine people who have what we call ambiguous sexual organs. They have two sexual organs, so they are not really men and they're not really women. But at times we kind of try to look at what is more dominant and build up on that. But now when it comes now to other issues where somebody now says they have a very, the sexual organ is male, but they're saying they feel like they're a woman, and vice versa. I think that is something that you can have a discussion about, and I don't know whether this is the right forum for us to talk about it, but I'll leave it at that and put a pause, first of all, because of time. I don't know whether we are going to add time, because now I see we have already only something like 7 minutes before we come to the end of it, so that you ask the questions, then we answer, then at least we can be able now to see. And if you want me to talk about it and give you my perspective about the same, then we can be able to do that.
I think since we started a little bit late by 15 minutes, if members so desire, we can add a few minutes, maybe like 10 minutes. And I want to take this opportunity to open the forum to the members to ask the questions so that Dr. can respond to them kindly. And I know almost all of you. So if you don't have a question, I may ask, I may pinpoint someone. Yes, I can see George Goge and Ashford. You have raised your hands. Let's start with George and then followed by Ashford.
Thank you.
George?
Yes. Thank you, Wamwiri and Daktari. Just have a question. Are you getting me, Douglas?
Yes,
yes, we can hear you.
Oh, thank you.
Proceed.
I have maybe two, and I'm sorry, the last time you were talking to me, I was engaged on a phone, so I'm really sorry. But I get good information about vaccines, and especially to the elderly. Just want to know, how are they really available in hospitals? Because I have an elderly mother, and this would be of help to her if I know whether we can really get them within the local hospitals around here. Number two, it's about the infants, the issue of mother suckling at from 0 month or 1 month to 6 months. Okay, there are some concerns, and I have seen it happen that some children, I don't know whether I would say they get hungry early, or they want to eat earlier than 6 months. Is it in order for mothers to open up feeding them before they are 6 months, or what would we do if such an instance happens, Dr.
Thank you very much, Bona George. Now, Bona Ashford, you can also ask a question so that Dr. can respond to all of them. And any other person, kindly press your hands icon, I'll see you. Or the co-host will see you from the other end.
Okay, thank you very much, Douglas and Daktari. This is a very, very educative forum. I'm happy to be involved. I have one concern. Can you hear me?
Yes, we can.
Yes, we can.
Okay. I did not quite get what really causes a poorly deformed sexual organ. I got lost on that area. And I also wanted to know how frequent should these vaccines for old people be taken? Is it every year, or once you take once, it can take a bit of time? Just that.
Okay.
Thank you.
Anybody else? Okay, maybe Dr. you can proceed. And someone kindly, we can hear background there, TV or radio. Can you kindly switch it off? Kindly, thank you. Doctor, you can proceed.
Thank you. Now, George asked about vaccines for adults and how readily they are available. Yes, they are available. Fortunately or unfortunately, you don't get them in public facilities. You get them mainly in public or rather private facilities. They're not so expensive. I know at times most of the people fear because they think they're quite expensive. They range between 800 to around 1,000 or 2,000. But at times you can go to some facilities, especially when you're using your insurance cards, they can go up to 4,000, 5,000, 6,000. So it all depends. But if you really want to have the same for your parents or for your elderly parents or even for yourself, you can always get in touch with me. We can organize how we can be able to get the same for you at a reasonable price. But they are good. It's a good thing to have for our parents. Now, thank you, George. And the other question from George was about infant feeding. There are many things that may cause a mother or a child not to breastfeed well for the 6 months exclusively. One, it could be issues to do with the mother, and when I mean with the mother, it's about the times when breastfeeding is not done well. A mother can develop things we call cracked nipples, or some mothers or ladies might have things we call, or something we call inverted nipples. And these are things that usually are supposed to be detected before they give birth, so that the inverted nipples can be, the ladies can be assisted on how to cause the inverted nipples to become better, even attachable during breastfeeding. Now, those are some of them. And in fact, even at times, even some diseases. And even when some mothers are using some drugs, or they make, because some of these things or whatever they're eating and all those things, they end up in the milk, and that might make the milk to have a different taste. And when that happens, that means that particular child will not want to breastfeed on the same. Now, those are issues. And also the other thing is, some of our women, because when they're breastfeeding, they become hungry so much. They don't want to gain weight. So what do? They start, they don't eat well, so they don't produce enough milk. And when they don't produce enough milk, the child or the infant will always keep on crying because they're not getting enough. And they're not getting enough because of what? Because of the mother not feeding well. So some of these things are related to that. So in the long run, those are some of the things that may be associated with the same. And at times, even diseases of the child, and at times you can, especially if a child gets sick and they're given some antibiotics and they develop something like, or some diseases or mouth diseases, or so that when it comes to them engaging to the breast, it becomes a challenge, then that means the child does not want to breastfeed. The only thing they prefer to do is to just get something from somewhere else, and it could be they just want to be fed using bottles or something like that. So it's neither here nor there. But those are some of the few things that are associated with that. But ideally, breast milk is usually the best way to go. Now, that was from Ashford. Yes. And also, I think Ashford also asked about the formation of sexual organs. It's not only about sexual organs we're talking about, but now because we are talking about reproductive health, that is why I'm zeroing on sexual organs now. But it's generally about the well-being of a child and what really affects their well-being or their formation well in the body. And that is when we talk about now things to do with the nutrition, things to do with what you take, drugs. When I talk about drugs, at times people talk about the substance that we abuse. At times, okay, which is still correct, because even that is related to the formation of the child, but also I'm talking about medication that you get, over-the-counter medication that you take, which, and that is why we are saying it's prudent when a mother is expectant, especially the first 3 months of pregnancy, for them not to take any substance that they're not so sure of when it comes to pregnancy. And I think I can see somebody by the name of Margaret Mwangi. Ameinua mkono. Please yes, you can tell us, so you can ask your question also. Thank you.
I can also see Ashford. Yes, Margaret Mwangi, proceed. Ashford, now, since you have asked, you can go ahead and then followed by Margaret Mwangi, kindly.
Okay. Dr. I think I also asked about how frequent should we take the vaccines. That one you have not actually reacted to.
Okay, noted, Ashford.
Yes.
Okay, Margaret Mwangi, can you kindly ask your question? Margaret, can you hear me? Margaret Mwangi, kindly ask your question.
Can you hear me, please? Hello.
Yes, we can hear you. Yeah. Okay, yes, we can proceed.
I was asking, there are some situations where the testes can disappear. I was asking, after the operation, can they disappear again?
Thank you.
Okay.
Any other question?
Ashford, were you through with your question?
Mine was just to remind the fact that he did not answer about the frequency of taking vaccinations for the elderly.
Okay, and how long those vaccine can be able to cover that person? How long do they take, or is it once you are taken, one, is it for how long, the duration?
Exactly. That's what I wanted to know.
I think also George had asked a question. The question that he had asked had that part, which Daktari maybe now you have reinforced it,
Yes.
and Daktari now has captured it.
Okay.
Anybody else, so that Daktari can answer all those questions? I think Daktari, you can proceed.
Thank you. Now, when it comes to vaccines, adult vaccines, the duration is usually depending on the health of the person and depending also on the vaccine. Like when you're talking about pneumococcal vaccine can last for at least 2 years, maximum 2 years. So every 2 years, you're supposed to be doing that. But now, when it comes to flu vaccine is given every year. Why? Simply because the flu virus usually mutates on yearly basis. So they look at the mutation of the virus, and then they make a vaccine that now is in line with the mutation. Then we go to the question that Margaret Mwangi has asked about the issue of undescended testes. When that operation is done, they cannot ascend again. Usually, what usually happens is that the channel or the path or that the testes use to descend to the porch, because usually they are they form they form inside the body and then they descend. In fact, at times when they are forming, they form like how the ovaries form. But now when the genital or the sexual organs specialize and it becomes defined well, then the testicles start to descend. Now, during that descent is when at times they get stuck along the way. And that is why the operation is done so that the channel is widened and they're pulled down to where they're supposed to be. And that is why you should not wait until later in life for that operation to be done, because when the testes are supposed to remain outside because they require a different temperature, which is a little bit lower than that of the body. That's why they're supposed to remain outside, not inside the body. I hope I've answered you well. Thank you. Now,
Thank you.
Yes, you're welcome. I don't know whether you have any other question.
Is there any other member who would wish to ask a question related to what Daktari have spoken or taught us today? Then if there is no question, okay, yes, Margaret. Are you asking a question,
No.
Margaret?
No.
Oh, good. Okay.
I'm satisfied. And I thank you for answering me. I was a victim with my son. Yeah, thank you.
Welcome. We are glad to hear that. That the question was answered to your satisfaction. I think, Daktari, you have covered so well in terms of birth and infancy and childhood. I think the part that has not been covered is about the teenage aspect. Have touched here and there related to vaccine, and but in terms of their reproductive health, I think there's something that need to be addressed there. And I can see time is it's not on our side, but it's like we have almost compensated for the time that we lost. So, Daktari, would it be in order to suggest that maybe next time you start from there? Reproductive health in childhood, in teenager, and geriatrics. And if this aspect of childhood, maybe, I don't know, maybe, okay, can you guide us?
I think it's in order. It's only that now they were supposed to be handled separately, all those topics. But anyway, we'll handle that next time. Teenage and pediatrics. And of course, I'm avoiding to go back to, which we need to. We'll cover teenage and pediatrics, then we'll come back to where we started. We talk about adulthood, so that we cover issues to do with fibroids and infertility in both men and women, factors influencing infertility in both male and female. And of course, I'm sure as we are continuing, as we are reading, or rather as we are learning, you have already started grasping a few issues that are associated with the same. You can be able to detect where some of the issues to do with infertility emanate from. And that is why I wanted us to start from where we started, so that at least we build a case, so that when we get there, it will not be very difficult for us to understand what we need to do and how we need to handle the things that we'll be talking about in terms of infertility. Because that is what matters. Reproductive health is all about. Otherwise, thank you for the opportunity. I hope we are learning something.
Thank you.
And because the forum is just about that. Learn, and even as you're learning, you can be able to educate other people within the society, within the community, why we do the things we do and why we are what we are. And just to make life more interesting and meaningful within the society and within the community. This is just a way of us giving back a few things back to the society or the community. Thank you.
Thank you. Well said, Daktari. Thank you very much. And we are learning a lot. Actually, everything that we are discussing here are matters pertaining to health. That's why this forum is proudly sponsored by Matters Health Association, of which I'm a founder member. And I want to thank all the members for having participated in today's episode. And we are learning a lot. I'm also learning a lot. And Daktari, thank you very much for a well-articulated presentation. And we are really looking forward for the same next week. From where we have stopped, I know we are going to proceed from there. And thanks, and again, I say again, thank you. Now, unless maybe in 1 minute, someone would like to say something before I close this forum. Is there anybody who would like to say yes? I can see George Koge, you want to say something.
Yes, Douglas, and thank you, Daktari. What I want to say is the approach Daktari has said. I think it will be good, and if we follow that approach, I think it will be of more benefit to us, and we can be able to follow it with continuity.
Thank you, George. Margaret, you want to say something? Okay, any other person? George, thank you for your comments.
No.
Well noted. And,
Thank you.
and okay, thank you, Margaret. Just maybe one more person. Gender.
Yeah. Just to appreciate and to thank you, Doctor. It is very educative. I think we will take advantage of it. May God bless you.
Thank you very much.
Thank you.
So I would like to take yes, Dr.
I was just appreciating the thank you. So I was just saying thank you. God bless you too. It's an honor to be of service to you guys.
Thank you once again, Dr. and all the participants. And I'm sure that we are learning a lot. Let us meet next week, same forum, same time from 7:30 to 8:30. And let us spread the news to others so that we can have as many people joining us so that they can also learn the same. Thank you very much. Have a blessed week ahead.
Good night.
You too.
Good night.
Good night.
Good night.
Good night. Robert.
Yes.
Yeah, I can see almost everybody has left.
Yeah. Now everybody has left now.